Hello and welcome. I'm Holly Gerstlin-Becerra,
And I'm Jenny Baldwin.
and we're the directors for the Preschool Development Grant Birth Through 5 Infant and Early Childhood Mental Health Consultation Program through the University of Texas at Austin through the Texas Institute for Excellence in Mental Health.
We're excited to introduce our MAP series for our new Infant and Early Childhood Mental Health Consultation Program Manual. We hope this series will be helpful for consultants, organizations, and other interested parties to get a snapshot of the 4 sections of the manual as we work together to build an infant early childhood mental health consultation system for Texas.
We truly appreciate your dedication to supporting the mental health and well-being of Texas' youngest children and their families. Thank you for taking time to explore and engage with this valuable tool.
The Program Manual Map video series will walk you through each part of the Texas Infant and Early Childhood Mental Health Consultation, or IECMHC manual. The manual is intended to set standards for IECMHC services in early childhood care and education, home visiting, early childhood intervention, and pediatric settings, and seeks to build upon the existing IECMHC programs across Texas. We recommend using the program manual for the design and creation of new IECMHC programs, modification of existing IECMHC programs, and/or for establishing competencies for IECMH consultants and their teams. This section, Part 3 of the Texas IECMHC Program Manual, outlines the training recommendations for organizations and individuals in Texas who are seeking to implement infant and early childhood mental health consultation, or IECMHC services. There are 3 categories of training in this section of the manual: educational requirements and recommendations for IECMH consultant qualifications, foundational training for consultants, and also considerations for agencies or organizations that oversee IECMH consultants. Requirements and recommendations are provided for each of these 3 training types. The first portion of this section of the IECMHC Program Manual, Educational Requirements and Recommendations, describes the requirements that consultants be licensed or license-eligible mental health providers and recommends that they have at least 1 to 2 years of clinical experience working with young children and their families. This section also provides detail on the definitions of licensed and license-eligible mental health providers. The second portion of the training recommendations section of the IECMHC Program Manual is about foundational training for consultants. Like the other portions, it includes a breakdown of what is required and recommended for entities that are supporting an IECMH consultant and implementing IECMHC. This section includes a helpful outline for orienting consultants and also emphasizes the importance of ongoing training around deepening knowledge of mental health and developmental disorders in young children, building competency in screening and brief assessment of social and emotional development, and strengthening reflective skills and practice. The third portion of the training recommendations section covers training recommendations for agencies onboarding IECMH consultants. In addition to key explanations of what is required and also what is recommended, it also includes a helpful list of sample resource library materials, which may enhance the IECMH consultant's practice. The final portion of the training recommendations section of the IECMHC Program Manual lists several key additional considerations for managers of consultants to support their ongoing growth, including provision of opportunities for the consultant related to ongoing peer support experiences, opportunities to highlight their skills, and creation of a professional development plan that reflects areas of interest to the consultant. This concludes the third of the 4-part video series for the Texas IECMHC Program Manual. Check out our other Program Manual map videos, which cover Part 1, Orientation, Part 2, Competencies, and Part 4, Evaluation.